Cardiac arrhythmias are irregularities in the rate and/or rhythm of the heart. They can be classified by site of origin into sinus rhythms, atrial rhythms, and ventricular rhythms. Sinus rhythm is set by the heart's natural pacemaker in the SA node. Normally, the SA node fires 60 to 100 times per minute, resulting in a normal heart rate of 60 to 100 beats per minute. Common variations include sinus bradycardia, a regular rhythm with a slower than normal rate, sinus tachycardia, a regular rhythm with a faster than normal rate, and sinus arrhythmia, a regular irregular rhythm typically within the normal rate. Sinus bradycardia and sinus tachycardia may be normal or pathological depending on the underlying cause. For example, sinus bradycardia is normal during sleep and sinus tachycardia is normal during exercise. Sinus arrhythmia is common among young, healthy individuals. It is often linked to the respiratory cycle, faster during inspiration and slower during expiration due to changes in the vagal tone. Respiratory sinus arrhythmia is normal and often associated with good cardiovascular health. On the other hand, sinus arrhythmias that are unrelated to the respiratory cycle typically result from an underlying pathology. Atrial rhythms are pathological. Common atrial rhythms include atrial flutter, atrial fibrillation, and AV nodal reentrant tachycardia, AVNRT. Atrial flutter or a flutter is caused by an electrical impulse that travels around in a self-perpetuating loop called a reentrant pathway. The atria contract with each cycle around the loop, resulting in a regular and fast atrial rate. The ventricular rate, or heart rate, however, is slower thanks to the refractory properties of the AV node, which blocks part of atrial impulses from reaching the ventricles. Ventricular rate in a flutter is usually regular, but can also be irregular. On an ECG, P waves are absent. Instead, flutter waves are present in sawtooth patterns. Atrial fibrillation, or AFib, is caused by multiple electrical impulses that are initiated randomly from many ectopic sites in the atria. These unsynchronized chaotic signals cause the atria to fibrillate, rather than contract. The atrial rate during AFib can be extremely high, but most of the impulses do not pass to the ventricles, again thanks to the refractory properties of the AV node. Those that do come through are irregular. Ventricular rate is therefore irregular and can range from slow, less than 60, to rapid, more than 100 beats per minute. On an ECG, AFib is characterized by absence of P waves and presence of irregular narrow QRS complexes. The baseline may appear wavy or flat depending on the number of ectopic sites in the atria. In general, a greater number results in a flatter baseline. AVNRT is caused by a small reentrant pathway that involves directly the AV node. Every time the impulse passes through the AV node, it is transmitted down to the ventricles. The atrial rate and ventricular rate are therefore identical. Heart rate is regular and fast, ranging from 150 to 250 beats per minute. In atrioventricular reciprocating tachycardia, AVRT, there is an additional accessory pathway between the atria and the ventricles, forming a shortcut that bypasses the AV node. This pathway allows part of the impulses to arrive at the ventricles sooner, causing a so-called pre-excitation. Tachycardia occurs when electrical impulses travel down one pathway, either the normal or accessory, then back up via the other, creating a loop or reentrant circuit. The frequency of this loop determines heart rate and can be very fast. AVRT can be orthodromic or antidromic, depending on the direction of the loop. Ventricular rhythms are the most dangerous. In fact, they are called lethal rhythms. Ventricular tachycardia, or V-tach, is most often caused by a single strong firing site or circuit in one of the ventricles. It usually occurs in people with structural heart problems such as scarring from a previous heart attack or abnormalities in heart muscles. Impulses starting in the ventricles produce ventricular premature beats that are regular and fast, ranging from 100 to 250 beats per minute. On an ECG, V-tach is characterized by wide and unusual shaped QRS complexes. P-wave is absent. A V-tach that lasts for more than 30 seconds requires immediate treatment to prevent cardiac arrest. Ventricular tachycardia may also progress into ventricular fibrillation. Ventricular fibrillation, or V-fib, is caused by multiple weak ectopic sites in the ventricles. These unsynchronized electrical signals cause the ventricles to quiver rather than contract. The heart pumps little or no blood. V-fib can quickly lead to cardiac arrest. V-fib ECG is characterized by irregular random waveforms of varying amplitude, with no identifiable P-wave, QRS complex, or T-wave. Without immediate intervention, amplitude decreases with time from initial course V-fib to fine V-fib and ultimately flatline.
Are you a fan of Alila Medical videos? If so, you will love our new Alila Academy. Based entirely on our highly effective animated mini lectures, our courses are designed to follow a typical syllabus in each subject. Each topic is extensively illustrated and comes with quizzes to test your understanding, downloadable PDFs for a quick review, as well as images for you to use in school projects or presentations. We are known for producing highly effective animated videos that explain the most difficult concepts in record time. We have no doubt that our courses will be a lifesaver for both students and teachers alike, so do come check them out. Alila Academy. Clear, concise, effective, with extensive visual resource. No one explains like Alila does.